Hi everyone, I'm going to talk about blood pressures when we use our machine that Tom's already begun to introduce you to. Before we start, it's important to say to get your patient comfortable. It's quite a good position here, so the arm's not hanging over this, thank you Tom. So your arm's not hanging over the side of the bed and the arm is rested. In an ideal world, we would like our patient not to have any caffeine or cigarettes within the half an hour or done any vigorous exercise. Not always possible if our patient becomes unwell, but that's what we like. There is two arms, or patient's arms, that we shouldn't use. One is a patient that's had lymph node removal from breast surgery, and the second is patients that have sometimes regular dialysis, they have an AV fistula, and we can't put a blood pressure cuff around those arms. In the hospital in West Suffolk, they're normally indicated by a green wristband. If they have that, it means you just have to go on the other side.
We'll talk about more what they are in our phlebotomy video. Also, obviously, artificial limbs. Don't take someone's blood pressure from their artificial limb. No.
So here is our blood pressure cuff that comes with these machines. There's different types. They have a little clip on the side, just clips on off like that. They have a little marker here, artery index marker, and it's the opposite side that goes onto the patient's skin. So find their brachial artery, put it across there. And on the side here, they've got like a little measurer. So there's 25 to 34 centimetres. If this marker here is any higher, they'll need a bigger cuff. If this arrow here goes all the way down here, you'll need a smaller cuff. Quite difficult to find sometimes. Once you're ready and you're happy, you press this little start button and you'll hear it begin to start cycling. If your blood pressure is healthy and your patient is well, it will read that as the cuff is inflating. If your patient's unwell, it might take a little bit of time to cycle and read the blood pressure. It'll normally deflate slowly, and that's when it will take its reading. Just pre-warn your patient that it can be a little bit uncomfortable, especially if it's taking its time. Patients complain that it gets really, really tight, so it's good to warn them. Tom's blood pressure, you can see there, is 138/91.
I don't do much exercise.
No, it doesn't. So once we've got our reading and we're happy, we'll remove that from the patient. Now these are reusable cuffs, but it's really important to give them a good clean and put them back around the machine.
Okay, so now we've done that, we're obviously going to record that onto our observation chart or you'll go onto eCare. And what we'll do now is we'll just talk about how you do a manual blood pressure.
Thank you.
Okay, so now we're just going to quickly run through manual blood pressures. All the same rules apply that we did with automatic blood pressures, so make sure your patient's comfortable, make sure you've got the right size cuff, that you line up the artery index marker, and that also that you make sure this is an arm that you can use, it's not an arm that you can't use. What we're going to do now is what we want to do with manual blood pressure is we want to cut off the blood supply, put so much pressure on the cuff that the actual artery squeezes shut and won't allow any blood to go through it, and then slowly release the pressure until the artery starts to begin to open with each contraction of the heart. When that happens, what we'll be able to do is listen with the stethoscope to that sound which is being created, and that first sound that we can hear is the first of the Korokov sounds. There are 5 Korokov sounds. They're all called different things like the muffle, the drum, or things like that. And we want to continue to listen to those until eventually all the sound goes away, so we know now the artery is fully open. When that happens, we call it the 5th Korokov sound, even though it is no sound. And then that is our blood pressure. So it'll be whatever the first sound is and whatever the last sound is. So 120/80 or whatever. So in order to bear that in mind, it's also worth thinking that the actual cuff can be a bit uncomfortable for the patient. So what we'll do first is we'll make sure that we palpate the patient's pulse, and then we're going to make sure that this little tap on the side of this pump is all the way down so the tap is closed, and then we're going to slowly inflate the cuff until this pulse goes away. Now obviously Tina, as we mentioned before, is fit as a fiddle, so I'm expecting her pulse to go away at a relatively low blood pressure, which it has. So once I've got that first reading, I know roughly where Tina's blood pressure is going to start, where the Korokov sound is going to start for Tina. Also want to make sure that I release the pressure of the pump. Now what I can do is I can place my stethoscope in my ears and I can inflate the cuff whilst putting the stethoscope over the brachial artery, make sure the tap is now closed again, and slowly inflate the cuff till it's 20 points over where we felt the pulse disappear. And then ever so slowly this time, release the pressure until I can hear the first noise of the Korokov sounds. When I can hear that, I'm going to take note and then continue to release the pressure until that sound stops. Okay, so Tina's blood pressure was 95/62. So once that's done, we can then take the blood pressure cuff off Tina's arm and we've got the blood pressure. As you noted in the previous video, Tina's heart rate is quite slow. So as Tina's heart rate is quite slow, it's really important to remember to slowly release the pressure. You know, bearing in mind your patient's comfort, but the slower you do it, the more accurate you're going to be with your reading. It can be a bit difficult to hear those sounds, so don't be disheartened if you can't hear those sounds. It's something that we will practice here in the classroom, and until you can get it right. Thank you very much.